Hi. You have probably found this video because you are an adult trying to decide if you should have braces and or jaw surgery, and you are thinking about this most likely because you have some issues and you've had dentists, orthodontists, other medical professionals suggest this is the road you need to take in order to fix your issues. And you're probably feeling the way that I did when I was first told this and are like, no way, I'm an adult, I don't want to have braces, and surgery is just out of the question. Well, I came to my decision not very easily. I spent 5 years or so trying to decide if I should do this. I had my wisdom teeth taken out, and shortly after that I started having some issues with some pain, especially when I was chewing food. I started chewing food on just one side of my teeth because it hurt on the other. And once I started seeing medical professionals, it was discovered that my bite was really off. Now, this is something that probably happened over a long period of time at a slow rate. It's hard to say at this point when it happened, but it got to the point where I was noticing it because I was having pain, my teeth were being destroyed, and I was having trouble eating food. I couldn't bite through pizza. I would take a bite of pizza with my front teeth and the whole pizza would come with it. Eating an apple, even if I cut it into a long piece, I would have to bite it off like I was a wild animal. I had to rip it off because nothing was coming through. So after speaking with a lot of professionals and working with them, at first I was like, I don't want to have braces or surgery, that's just crazy. Then finally, after so much time had gone by, the situation wasn't getting better and I knew I had to do something about it. So I finally wanted to start new, talk to somebody new, and then make a decision there. And I was referred to Dr. Leone and Dr. Vaughn, located in Queen Anne and also Madison Park. I had my initial consultation with them. They took records, pictures, x-rays, everything, and kind of showed me what the situation was and what their suggestion would be, that surgery would also be part of the plan because they can only go so far with the braces. And I also found out that about 50–51% of their patients are adults, which is great because this means they're very familiar with adult situations and working with a jaw surgeon, and adult situations are obviously a lot different than children. So once I decided to do it, I got my braces put on in November of 2008, and I think after about 4 to 6 months I had my initial consultation with Dr. Trimble, Dr. Douglas Trimble, and he is at Overlake in Bellevue, and decided, okay, I'm going to do this. I've come this far, I need to fix the situation because it wasn't getting any better. So I then had my surgery in June of 2010. Details of the surgery, there's a lot of details of the surgery. It's a huge, huge decision. If you decide to go through with this, these are, things you will find out. But you need a couple weeks recovery time after the surgery, and but it was worth it. I got my braces off at the end of March 2011, so just a few weeks ago, and I'm very, very happy with the results. Before the surgery, Leone and Vaughn actually had to create some kind of large spaces for the surgery, and at that point Dr. Leone and Vaughn work with Dr. Trimble, and the surgeon actually tells them to put this tooth here, put this tooth here, where he needs it in order to successfully bring your bite together in the surgery. And after the surgery, you still have your braces for up to 6 months or longer, so that they can maybe bring spaces back that they had to create for the surgery, and do some final touch-up things. I'm so happy with the surgery and with my results. Along the way, as an adult, you are a little more aware of what's going on when you go see the orthodontist every 4 to 6 weeks or whatever it may be. And I would have questions about certain tooths, where it's located, and I would call it out, say, this tooth is doing this, why? And they explain it perfectly and take the time so that you understand what's going on. Children, when they go see an orthodontist, they don't ask questions because they don't know what questions to ask. But every question I ever had or concern was addressed, which was great, either with Dr. Leone and Vaughn or with Dr. Trimble. Because trust me, I asked a lot of questions and they all got answered. So my final results are now that my bite comes together, all of my teeth touch, and I really love my smile, especially without the braces. I didn't really have a problem with my smile before, but this was not a decision I made for cosmetic reasons in the least. It was medically necessary in order for me to live a happier, healthier rest of my life and not have major issues down the road, possibly with my gums because of what was going on with my teeth. Here's a picture of my side profile of before and after. This is before, this is after. As you can see, my jaw came forward and up. And here are pictures of my bite before and after. Here's my before, where you can clearly see my bite is open, and this is the after. And here is one side where you can see it open there, and these teeth are not sitting within the grooves like they're supposed to here. Oops. And here is the other side, before and after. So, I hope if you're an adult and this is suggested to you, that I've helped you decide whether or not to do this. And my recommendation is for Dr. Leone and Vaughn, because they are just the utmost professionals, and like I said, they work with a lot of adult patients, so they're very familiar with our issues. And hopefully they would send you to Dr. Trimble, and he is wonderful too, very, very wonderful. The best. All right, thank you. Peace out.